I remember talking to a nurse who worked in a COVID wing and asking her, are you suffering from post-traumatic stress disorder? And she said, probably, but I certainly don't have time to go see a therapist right now. I've got a job that demands that I'm there and present. I'll go and see one after the pandemic. But what we're seeing now is a lot of those people are just chucking the careers. I mean, the burnout, can you talk to us about that and the difficulties of actually having to be on the front lines?
Yeah, the burnout on the front lines, burnout to say the least, but also, as you're saying, post-traumatic stress symptoms, even post-traumatic stress disorder, rates of depression, anxiety among first responders and other people on the front lines. It's been quite a steep increase in the rate. So it's very concerning. We always talk about, so when you get on the airplane, they say, in the event of an emergency, make sure you put your own mask on before you assist others, and that's very true for responders, medical responders, therapists. We all need to be thinking about how we're taking care of ourselves so we can take care of each other.
And you're there at a university, and we're seeing a lot of problems with young people as well. They have to deal with so much right now. Of course, we've had these school shootings in the news, and then along comes COVID. The levels of anxiety, depression seem to be skyrocketing. Can you talk to us about that? Because young people generally, they're not thinking about their own mortality, but now I think they're kind of faced with it.
Yeah. These are incredibly heavy times for young people. I think the word unprecedented gets thrown around a lot, but these are unprecedented times. The number of crises on top of one another is really staggering. And the young people we're working with, whether children, adolescents, young adults, as you're saying, the sort of problems of despair, of resignation, of depression, of grief, we're seeing very high rates.